8:38, time for our Bronson Med Chat. This morning, we're going to talk a little bit about a topic that kind of scares some people off sometimes, and it's hospice. You know, sometimes people will delay hospice services for some reasons, and we're bringing in the manager of hospice services at Bronson at Home, Christina Shively. Good morning, Christina. How are you?
Good morning. I'm fine. Thank you. Thanks for having me.
You're very welcome. It's nice to have you here. Hospice can be kind of a scary word for people. What is it that you found that people are most afraid of about hospice?
Well, I really think the whole word hospice is just, it is a scary word. People, it's kind of the unknown. People don't really know what hospice is, what we're all about, what we do. I think also people are afraid when hospice is said that means giving up. And really, to the contrary, it does not mean giving up at all. We just kind of change the focus of things. We focus more on quality of life versus quantity of life. We just really look at what we can do to assist them for whatever time they have left.
What are some of the benefits of moving into hospice sooner maybe than later?
Well, probably the comment we hear more often than anything from families that have had loved ones pass on hospice is, we really wish we had started hospice sooner. We wish we had heard about it sooner. We wish we understood what it was sooner. And we wish we would have understood the benefits. Unfortunately, we have some statistics from 2014 that 50% of patients were actually either passed away or discharged within 14 days of coming on hospice, which really doesn't give us a lot of time to do what we can do for the families and for the patients. By coming on sooner, I think the biggest thing is you develop a relationship with your team that's coming in, the nurse and social work. You get a sense of trust with them. You know that you've got somebody going through this process with you, somebody that's knowledgeable, and just kind of help to navigate through everything you're going through, navigate through the healthcare system, through the decision making, through any caregiving or placement issues. There's just so much that we can offer the families on top of giving them services so they can really focus more on being family members and less on being caregivers. They're still the primary caregivers, but we can give them tips and we can give them some help that just helps that whole process go a little smoother.
We're talking with Christina Shively. She's the manager of hospice services, Bronson at Home. Christina, this has kind of prompted a question that I'd like to ask about, kind of concerns us. When should people begin thinking about utilizing hospice services? Is this something they talk to their doctor about? Is this something that's just a family type of situation? Or
Well, no, you're exactly right. Really, the doctor is the best place. As they're learning more and more about their condition from their doctor and, hearing things like, there's choices and options and hospice might be an option or, that maybe it's no longer time to continue treatment. It's time to start thinking about stopping that. So it's time to ask the doctor, well, what about hospice? What does that do for me? What option does that give me? And, is it time for hospice? We're generally looking at a 6-month or less prognosis. So, it's really up to the doctor to know that and decide that and help guide you to when it's time for hospice. But a lot of times the treatments will go on and things will continue that, people really would benefit more from hospice and stopping some of those treatments. It's just very, very hard decisions, and we do help navigate through those decisions. Those are things that people don't have a lot of experience with, and so it helps to have experts on your team that know about these things and can utilize their expertise to help you making those hard decisions.
Speaking of team, who makes up the hospice care team?
Well, we have quite a few members, a lot of different disciplines. So we have primary care RNs. We have on-call RNs that can come out to your home. We do visits 24/7, so we're available 24/7, not to be there all the time, but certainly to cover any crisis things that come up. We have social workers. We have home health aides that can come in and do the bathing and care for the patient. We have spiritual care providers. We have volunteers. We have a bereavement coordinator. Our bereavement deals with, of course, the families after the death. So lots of different members make up the team. And, of course, the primary member is the primary care physician or our medical director. They certainly guide anything that has to do with symptom and pain management and help guide the whole team through, the process of what we need to offer the family.
You know, a lot of people know primarily, what is offered and what you listed too with hospice as far as the team members. Are there any additional services that are usually offered by hospice?
Well, probably one of the big things we offer is our volunteers. We have many volunteers that go through an extensive training, and they can be available for a number of different things. They can come just for companionship, and so that family members can get out of the home a little bit and run errands and do appointments. They can even do a little bit of light housekeeping. The volunteers themselves can run some errands if going to the grocery store or picking up things is helpful. They can do that. We also have vigil volunteers. We have trained volunteers for those people that don't have a lot of family or caregivers. We want to make sure that nobody is alone when they pass, and so our vigil volunteers will sit in the nursing homes with patients or sit in foster care homes or even in the patient's home and just be with them, offer that companionship and that just having a person with them all the way through. So we offer that. And then I just wanted to mention in terms of our bereavement services are offered throughout the community, not just for our hospice patients. So anyone that has suffered grief and loss, we do provide counseling, whether it be on an individual level. We offer grief recovery groups, kind of an educational type group for folks, and really anything that they need to get through. And we offer special holiday workshops because we know that the holidays are a hard time to get through after you've lost someone. So very important service that we're able to offer the community as well as our hospice families.
We're talking with Christina Shively. She is the manager of hospice services at the Bronson at Home. Christina, are there any downfalls to hospice?
Well, I think what most people find is they wish they had done it sooner, like I mentioned earlier. The one thing people need to know is that if for any reason they come on to hospice and it's not the right service for them, they decide they want to go pursue things more aggressively, at any point in time you can come off of hospice, so it's always an option. We actually have people that what we call graduate from hospice. They get on hospice and they do better. It's a wonderful thing to do better. Sometimes they come back at a later time, but there's always options. People can try it, see if it works for them. Very few people, choose that manner. They choose to stay because it is helpful to them. They appreciate the support and the team in with them and just somebody to help get them through this difficult time.
Christina, where can we learn more information about hospice and especially Bronson at Home?
Well, you can visit our website at bronsonhealth.com/hospice sooner. There is an article and more information about hospice there.
We appreciate I don't know if I want to call it demystification, but I think it's more a kind of a smoothing, because when people hear hospice, obviously there's one thought that comes into their head, but there's so much more involved and so many more people involved. And it's good that we've had you on so that we can kind of take a little sting out of the word, and you find out that, hospice is a natural part of life. Right. And it's something that can be a wonderful experience if you allow it.
And it's really about making a very difficult process as easy as it possibly can be. I mean, we really try to focus on what the patient and family want and need, and they guide what we do and what services we provide. And we even try to help them accomplish some goals and dreams they still have. If they can do them, that's so important to get them through this process and do it in the best and easiest way we can.
And what's the website that they can go to again?
Again, it's bronsonhealth.com/hospice sooner.
Christina Shively is the manager of hospice services for Bronson at Home. Christina, thank you again so much for stopping by today in our Bronson Health Chat.
Again, I appreciate you having me on.
And we hopefully will talk to you soon again down the road.
Okay, thank you so much.
Take
Have
care.
a good day.
You too.